So diabetes mellitus is your typical sugar diabetes, and that's what we generally think of when we talk about a pet having diabetes. So we tend to see two different types of diabetes in animals. In dogs, it tends to be a type 1 diabetes, so you're insulin responsive. And that basically comes about because the body wipes out the insulin producing cells in the pancreas. And that basically means that the body doesn't get the insulin that it needs to take glucose into the cells. And so the glucose stays in the bloodstream. But also what happens is the cells basically tell the body that they're starving because they're not getting that insulin. And so the feedback mechanism basically tells the body to release more energy. So the body will produce more glucose to try to feed those effectively starving cells. So a few things that come about from diabetes mellitus. One is that dogs and cats will pee a lot more, and basically what happens is the glucose goes out in the urine and that draws a lot of fluid with it, and so that increases the volume of urine, which means the animal then needs to drink more. And so quite often the first thing that people will come in saying is, look, my dog or cat are drinking and peeing a lot more than normal. So that's really the most common thing that we see them come in for. When we get a diabetic animal, like I was saying, because the cells are effectively saying they're starving and they're trying to get the body to produce more energy, what the body can do when it's trying to produce more energy is take a little shortcut effectively, and instead of producing glucose, they produce a product called ketones. And ketones are basically an energy source that the body can produce much quicker than it can produce glucose. And in a normal sort of situation, so evolution-wise, if an animal is having to run very hard for quite a period of time, or kind of go through a very stressful sort of period, then those ketones would be quite useful. But because with a diabetic animal, they keep on producing, they build up in the bloodstream, and they're quite acidic. And so we can end up with so many ketones in the bloodstream that the animal's blood becomes acidic, and they can get very, very sick very quickly. So diabetic animals will sometimes come in collapsed, and it's generally because of the ketoacidosis, so the build up of those ketones in the bloodstream. What we tend to see secondary to diabetes in dogs is cataracts is a very common issue, and most diabetic dogs will actually end up with cataracts, and we need to look at treating those surgically to basically restore vision to these dogs, and that has a fairly high success rate. We can also start to see a lot of secondary infections, so these dogs are prone to dental disease, to bladder infections, those sort of things. So it all needs to be dealt with as a whole body, rather than just putting them straight onto insulin. We need to make sure that the rest of the animal is actually doing well. With cats, we tend to see more of a type 2 diabetes, and it's quite similar to in people where overweight cats are more prone to the problem. We do tend to use insulin in these cats because what has been found is that early, relatively aggressive use of insulin, and also dietary management, because in cats in particular we tend to use quite a specialised diet, can actually reverse the onset of diabetes. And so we can end up with a cat which you could almost consider it still being a diabetic cat, but it's got normal blood glucose and it's not needing to be on insulin. So cats, we are really best off treating those very aggressively. Same with dogs, we want to be avoiding a lot of the secondary problems. So far as the management of diabetes goes, the big one is to be giving insulin. So just the same as people, it might be once or twice daily giving the insulin and trying to get things back into a normal sort of range. And like I say, we tend to manage the secondary signs. We manage things with diet, and so we're looking at either a specialised diet or a home-cooked diet with fairly specific needs, and your vet will be able to discuss that with you to really let you know what's going to be most appropriate for your pet. But like I say, it is something where we do see a few secondary problems, so we need to be looking at the whole animal, making sure the mouth's healthy, make sure there's no secondary infections. And we tend to find that with a lot of effort, these dogs and cats can go on to live a relatively normal life. Now, it is a condition that we can't really go in treating it half-hearted. They do need to be treated properly, these cases. If we're going to manage them, we need to be consistent with things like their insulin, their exercise, their diet. That all needs to be done well. So it is a serious chat we always have with pet owners when the animal's diagnosed with diabetes. Look, are you able to actually do the work that's needed? And if we can do that work, we can quite often get some very good results. And now that there's some more technology coming on board, so we're getting better monitoring equipment where it can actually be worn by the animal and they can have a more normal sort of life when it comes to monitoring and trying to stabilise their diabetes. I think we're not far off this actually being much easier to deal with, and as things improve with people, it's going to flow onto our pets as well. So yeah, it's a condition that it's a challenge, but we can do a lot for it.